Good morning, everyone. This is Muhammad Musafir. Today, I wanted to discuss with you a topic that I received actually few requests to talk about it, especially from countries outside the United States. And the topic that we want to talk about today is about the U.S. healthcare system. So basically, a lot of physicians and healthcare providers outside the United States, they usually inquire or they would ask, and they would they want to basically to better understand how the U.S. healthcare system is structured and how it is different or similar to the healthcare system that they experience in their own country. So, for today's discussion, I'm gonna try to highlight some key points around the U.S. healthcare system or about the U.S. healthcare system that probably makes it a little bit unique and perhaps makes it a little bit different than other healthcare systems that we can see or experience in other countries. First, in order for us to understand the existing structure of the U.S. healthcare system, we need to go back and ask the question, how did the US healthcare system evolve over the years? Because what you see now is not what existed, 20 or 30 or 40 or 50 years ago. The US healthcare system has gone through a process. It evolved over time as a result of certain political events and as a result of certain societal events and as a result of even the war in 1940s and so forth. So in order for us to start that discussion, I'm gonna try to break it down into three areas. We will talk about the evolution or the development of the US healthcare system from the disease side, from the disease management perspective. We're gonna talk about it from a technological advancement, and then we're gonna talk about it from the organizational structure, how it is organized. First of all, when we talk about the disease management, so obviously the U.S. healthcare system, as I mentioned, has evolved in many ways over the past decades, and that evolution or that progress is a result of different factors that impacts today's healthcare structure the way you see it. On the disease side, if we're going to start by that point, we can say that the healthcare system in the United States has moved from an acute care model targeting epidemic infectious diseases to acute care model that is focused on individuals and focused on acute care events. What that means, basically, after the Second World War, the U.S. healthcare system had experienced a shift. It shifted from acute care model that basically was focused on caring for those individuals that came from the war, caring for the veterans and the different infectious diseases that existed at the time, to acute care model the way we experience it today, that's focused on chronic care management, that's focused on managing various chronic conditions, and these chronic conditions basically tend to be the main conditions that drive spending, that drive cost, that drive utilization in the existing healthcare model. So basically, right now you would have an acute care model, which means you would have hospitals and different acute care facilities that would focus on managing or caring for cancer, that would focus on managing or caring for heart diseases, for a stroke, and for a wide range of complications as a result of some of these chronic conditions. That's what we have now. Obviously, I would even add to that, it has evolved even beyond that, especially in the past 10 years or so, that the focus has been really more around like emotional and behavior disease management or emotional and behavior health disorders, the integration of the medical and the behavior health into the care model, focusing on obesity, focusing on child care, focusing on senior care, These are probably, new areas where the existing U.S. healthcare system is spending money right now, or is trying to evolve around those areas to manage the utilization and to manage the cost and to manage spending around those chronic conditions or certain populations at this point. We can also see that there is some attention or some focus that is being given to public health, is being given to prevention, health promotion. Although it's a little bit limited, but obviously that's a trend that we're seeing in the existing healthcare model in the United States on the disease side. The society and the providers and the system and the politicians, they basically have realized that we have to do something about prevention. We have to do something about health promotion. We need to keep people healthy. We need to keep them healthy so they do not end up in a high spend category. They do not end up in as high cost patients, or they do not end up with multiple chronic conditions that later on need to be managed at a higher rate or at a higher cost. So that's really the perspective that we see right now when we talk about healthcare from the disease management side. The other thing that I wanted to highlight is the looking at the U.S. healthcare system from the technological advances, from the technology side. Basically, the U.S. healthcare system has moved from a system that did not have a lot of technological interventions in care, in clinical delivery, as early as 1900 or so, to now more scientific, evidence-based, clinical and medical-based medicine. There is a strong integration between research and between care delivery at this point, and there is a lot of investment that's been happening on the evidence-based medicine research side, making sure that what we're doing for the patients is the right thing, and making sure that what we're doing for the patients is the appropriate and the optimum care that we could provide at the point of caring for them. And when we go back, even also back to the Second World War, we can see that there was a need for that. Again, you ended up having a lot of individuals coming from the war that you needed to care for them, and obviously the technology that existed at the time was very limited. So that drove a lot of innovation, that drove a lot of spending, that drove a lot of investment in technology, in medical technologies, and in technological intervention to cure patients and to manage a wide range of diseases. I would probably say that the new clinical and medical technologies that are currently being introduced to the US healthcare system, its objective has changed over time as well. 20 or 30 years ago, probably most of the medical technologies and most of the interventions or the technological interventions or the innovations that we had, they were basically aiming to improve chronic or a specific acute medical condition, and maybe even like post-trauma condition at that point. Recently, though, however, we can see that there is more technology and more investment and more innovation that is happening to deliver care in a more advanced way, in a more sophisticated way, if you will. But also, somewhat, it's a little bit expensive as well. As you invest in innovation, as you invest in technology, you're spending more on the US healthcare system. And as a result, you could be also driving the cost and driving spending, in a different perspective. But definitely, most of the technological innovations that we see now, it is focusing on managing chronic conditions. It is focusing on prevention. It is focusing on early diagnosis and managing patients in a progressive way. It is also focused on behavioral health disorders and lifestyle changes. Because the system or the healthcare providers, they have realized that any technology or any innovation, or even for the entire system to be successful, it will need to target and focus on prevention and preventing patients from getting to that acute or the chronic condition that basically requires a significant spending and requires a significant and more complex care to manage them. That's basically on the disease side and on the technological side. The other thing that I also wanted to highlight is the organizational structure of the US healthcare system. So again, after the Second World War II, there was not really a formal structure in a way. The military at the time provided significant amount of care. There was not really a formal structure. You had hospitals and providers in different areas providing care. I think I would probably argue and say that currently in the US, we also do not have a very fully structured system. I think when you look at the US healthcare system at this point, you can see that we have different subsystems, we have different organizations and different organizational structures that provide care, that manage patients, that finances the US healthcare system. Now, to what degree or to what extent they talk to one another or communicate to one another or coordinate with one another, it's probably very limited. So they do not have a lot of coordination, meaning if you're a patient and you get sick and you end up going to a hospital A and you get care at this specific hospital in your local community, and you travel to another state and perhaps you get sick again and you have to go to another hospital in a different state, those two systems, those two health systems, those two hospitals, they are not connecting. So basically the providers in the existing hospital would have to communicate by fax or manually or phone call with the other hospital where you had care in the past, and they would probably try to inquire and get some of your medical records moved over, so that way they would understand your condition and they would figure out how to manage it or how to address it. So it requires some labor effort to create some coordination between different systems. I think we can also highlight the fact that right now the system is more complex, and therefore when we talk about access and affordability, those are two areas that we should highlight. When we talk about healthcare financing, which is a topic that we might discuss later on, here in the US, the health insurance industry, it plays a very significant role in paying for healthcare and financing healthcare and covering individuals for healthcare. So they are an important subsystem or an important player in the existing US healthcare system. And they work very closely with the various healthcare providers. They work very closely with the government to be able to contain the cost, to be able to manage utilization. We also want to highlight the fact that the existence of Medicare and Medicaid. Medicare and Medicaid is basically, and we'll talk about them later on in greater details. Medicare and Medicaid, it's a different subsystem. It's a government organization that basically is aiming to care or provide care for those that are seniors, for those that are elderly individuals, 65 or above, and also through Medicare, and then through Medicaid for those who do not have certain income or they have certain financial ability to be able to pay for the care on their own, or they do not have certain insurance or certain coverage that would allow them to access the care when they need it. As we continue to see rising in healthcare costs, as we continue to see more spending and more utilization happening, and US spends at least about 1/5 of its GDP on healthcare. So we're gonna start seeing, or at least we've started seeing, the government being more involved in care delivery, being more involved in organizing the healthcare system, being more involved in managing a wide range of initiatives that would have a greater impact on the entire population, if you will. An example of that is the Affordable Care Act during the Obama administration. The Affordable Care Act was basically a law that was put into effect to help covering the gap in coverage and allowing people to access care in the event that they do not have it. So it expanded coverage. It allowed people to have different options and different alternatives to access care through partnership with different hospitals and different providers and different health plans or health insurance providers. So the more we see the spending continue to go up, the more likely we're going to see the government working closely with the private sector and adopting different initiatives and different strategies that would have a greater impact on the general public, and in order to allow for the cost to be contained, in order to allow for that cost to be under control, and in order to allow for greater access for the general public when they seek care. So affordability and access is a big thing that probably we need to highlight, especially the Affordable Care Act that went into effect in 2010. I would probably say, given that in the current system you need to have insurance, for example, or you need to have Medicare or Medicaid to pay for your care, or you need to be part of the military system, or you have coverage paid for you by the army, or by the Department of Defense. Um, we can also argue that healthcare is really connected to the idea of privilege in the US, meaning that it is not given or offered to anyone regardless of his or her status. In order for you to have coverage, in order for you to seek care, you either have to be able to pay for it, or either you have to have a system, or you have to have a structure that covers you, that would allow you to access the care and would allow you to pay for it. So currently we don't have a system that basically offers care to every single individual, every single American. They have to get it through various organizations and through various uh, partnership or payment structures or coverage that would allow them to access the system, that would allow them to get the care that they need. So that's in a way, when you think about the US healthcare system, it's hard to say it is a universal healthcare delivery model. It's harder to say, it's unlikely to say that it's a single system where everyone could get care anytime they need care, regardless of their financial situation or their income or their job. It is still closely related to income. It is still closely related to having a job. It is still closely related to certain financial ability to be able to access the system and to get the care that you need. So that's what makes it a little bit unique and different than other systems. I want to go back to the point in the next couple minutes of the idea of a system. I want to go back and highlight the fact that the US healthcare system, again, doesn't really have a very stronger or a very consolidated universal healthcare system. You would have various subsystems, as we discussed, and one subsystem, for example, is for the young, for the insured. That's basically through hospitals and through the various health insurance companies, those that are 65, less than 65 or younger than 65. Those who are in the workforce, those who have jobs, those who have health insurance through their jobs or through their employment. So such population or such group, they end up getting care or getting healthcare services through these various managed care organizations and through these various health insurance companies. So they need to have a job, and that job needs to offer health insurance, and then through that health insurance they can go to the hospital, they can get the care that they need for their individual need or for their loved ones. And then you also have a system or another subsystem that's for the uninsured, as we mentioned. These are individuals that they do not have certain income level. These are the individuals that perhaps they do not have jobs, that they maybe struggle a little bit financially, and then you end up covering them through a government program that's called Medicaid. Also, it covers children as well, of certain groups that have certain income limitations. So basically Medicaid is sponsored by the government. It's a program. It gets a government subsidy, and it provides care to a certain group of individuals that have certain income limitations, and it's closely tied to the poverty level in the U.S. or certain poor social or socioeconomic status for some of these groups. And then you have another system that's basically specific to the Army or the military veterans, or those who are in active duty. That's basically run by the government through the Department of Defense and through the Veteran Affairs. That's a department in the U.S. government, and it's it gets funded by the government, and it provides care and provides access to these specific groups. And then obviously, if you are a person or an individual that do not fall within certain socioeconomic limitations, and you do not have a job, or you have not been able to get on Medicare yet because you're younger than 65, you would have some limitations. So for example, take a group of individuals that are 59, 58 years old, who are not employed, but they have a house and they have certain income coming to them, not necessarily working part-time, for example. These individuals might not be able to qualify for coverage through their employers, they still cannot get qualified for Medicare. They have certain income, so they might not be able to get qualified for Medicaid, and therefore they might not have full coverage. They might have limited coverage, or they may have to pay for their care whenever they need it. So all these different organization structures, as you can see, it imposes certain limitations on the US public when it comes to seeking care and accessing care through various hospitals and various channels. The other thing that I also noted here that I wanted to highlight, there are main players in the existing US healthcare system. I would say probably there are 5 major players in the existing US healthcare system. You have patients, who are the main individuals that seek care. You have providers, and when I say providers, I mean organizations, hospitals, physician groups. You have payers. These are the health plan organizations. These are the insurance companies that pay for the care, that cover people. You have vendors. These are different groups and different companies that offer certain technological innovations, that offer certain utilization management tools to allow hospitals and health insurance companies to be efficient and to be productive. Probably I would include pharmaceutical companies, under the vendor, section, because to me, pharmacy or medications is a tool, is a technology that we're offering to manage care. And then obviously you have the government through the various organizations such as the Department of Health and Human Services, such as Medicare and Medicaid, that basically these government organizations, they play a significant role in shaping and delivering, in shaping and managing the way healthcare is being delivered in this country. In terms of the structure of the US healthcare system also, I wanted to highlight the idea that yes, it is well run, because these subsystems, they try to coordinate with one another, but it can be uncoordinated in a certain way. And let me give you an example. So you would have hospitals. These hospitals are independent. They are private. Some of them are for profit. Some of them are not for profit. They are not run by the government. They are not managed by the government. They have their own leadership. They have their own vision. They have their own objectives. They have their own funding. They have their own limitations. And then you have specialty hospitals. The specialty hospitals, these are hospitals that very focused on certain conditions, like oncology, like cancer, like cardiovascular, like orthopedic. These are hospitals that provide care specific to certain conditions or specific to certain medical specialties. You have ambulatory surgical centers. These are freestanding centers that you walk in, you get care, you get a procedure done, and then you walk out. You do not stay overnight. You maybe stay under observation for a couple hours, and then you go home after that. You have primary care offices. These are the primary care physicians and the family practice physicians that provide care to the patients, as you walk in or by appointment. You have different physician groups. These are basically 5, 10, 12 different physicians coming together, creating a practice. That practice could be very specific to a certain specialty. It could be very specific to certain populations, and they offer care and services to that group or that population. Pharmaceutical services. These are the pharmaceutical agencies or the pharmaceutical companies that basically invest and innovate in pharmaceutical products and offers different drugs and different medications for various conditions. These are pretty independent. They are privately owned for the most part. Some of them are for profit. Most of them are for profit. They get money from the stock market, from investors. They have their own leadership. They have their own objectives. They have competing priorities, and they have their own structures. And then you have dental medicine, dental services. These are different dentists coming together, providing dental care. Vision, same thing. So as you can see, each one of these systems are very independent. Each one of those systems is very independent. It is managed by different groups and different leaders. It has different objectives. It has different budgets. It has different priorities. Each one of them is able to raise money in different ways and provide care in different ways. So when you have organization or when you have a structure like that, it obviously makes it a little bit challenging. And keep in mind, we haven't even talked about rehabilitation services. These are different facilities that offer physical therapy and physical medicine and rehabilitation services, speech and occupational therapy. We haven't talked about, public health offices, different government offices that basically look at different epidemiological events and provide public health prevention and public health education. We didn't even talk about long-term care. These are different nursing homes that basically provide care to certain senior individuals or allow geriatric care to exist in their facilities, or they allow certain senior individuals to basically live there and take care of them. And then obviously you have the emergency department, which is a different subsystem from within the hospital that provides care to patients in the event of emergency or trauma. And sometimes some of them are independent from the hospital, some of them are part of the existing hospital structure. So when you have to coordinate care between all these different groups, and keeping in mind each one of them is a private entity in a way, each one of them is for-profit or non-for-profit entity depending on their structure, you end up running against certain competing priorities, you end up running against certain challenges. The government has to play a bigger role in coordinating some of this care, and also these organizations or these systems, they also have to work and try to coordinate as much as possible in coordinating care and providing care to their members or their patients. I hope this was very insightful, and I hope that was very helpful for you to understand the U.S. healthcare system at a very high level and answer some of your questions. I will try to talk about different topics within the U.S. healthcare system in the coming discussions. Thanks again.